So it's my pleasure today to start the second presentation by Dr. Chi Godloves FRU, who is going to talk to us about a plant called Tetrapleura tetraptera, a potential source for natural products against cancer, bacteria, cardiovascular diseases. Dr. Chi is a researcher and assistant lecturer at the Department of Chemistry, University of Buea in Cameroon. You are very much welcome, Dr. Chi, for today's webinar. And please share with us. I will your slides.
Oh, I'm to share my
Yeah,
slides?
okay. I will do it for you.
Yeah.
Just 1 minute. Can you see the slide now?
I can very well see.
Yes, okay. So please, the floor is yours. Let me.
Thank you so much, everyone, fellow NAPRECANs, for giving me the opportunity to present my work to you, titled Tetrapleura tetraptera, a potential source of natural products against cancer, bacteria, and cardiovascular disease. Next slide, please. So my talk would follow this order. I'll talk about the plant and some diseases, with phytochemistry, some bioacids, and immunocomplexes. Next slide. Now, in 2016, world leaders put forward 17 sustainable development goals. We can see that goal number 3 in green, which reads good health and well-being, concerns us natural product researchers. Next slide, please. And so each year, about 18 million persons die of cardiovascular disease, about 10 million of cancer, and about 4.5 million linked to antimicrobial resistance. And so we are 10 years down the line to attaining the Sustainable Development Goals, but disease still is upon us. Next slide, please. A sustainable way of getting medication is looking at plants, the very origin of so many medicines. So we studied the plant called Tetrapleura tetraptera, plant of the family Fabaceae, which has just 2 species, Tetrapleura tetraptera, which grows in West, Center, and even East Africa, and another species called Tetrapleura chevaleri, which has not yet been studied. Next slide, please. Now, this plant is easy to identify. It is used as spice. In Ghana, it is called prekese. In Nigeria, aridan, and katrokote in Cameroon, where it is used to make delicious meals, including achu soup, and also for treatment of certain diseases, diabetes, hypertension, and others. Next slide. So you can see a picture of one of the meals made out of the spice. And as researchers, we visited a reserve forest called the Ja and Lobo Reserve Forest in east of Cameroon and brought back a lot of this fruit. So I checked the literature to see if it was interesting to work on. But I was discouraged because I found so many works, particularly that of Note and Adesina, presenting metabolites from this compound. So I didn't work on it from this time. And some years later, I visited the University of Botswana as a researcher, and Professor Yeboah brought about 1 kilogram of this fruit, presented it to me and said, this is prekese from Ghana, choice spice. Please, can we see what is in it? And so I was forced to do the literature search on this. Please, next slide. Now, searching the literature, there was a lot on the pharmacology, phytochemical analysis, phytochemicals and constituents, and isolated compounds. Next slide, please. But we noticed that few metabolites had been isolated and identified belonging to steroids, steroidal saponins, triterpenoids, saponins, and flavonoids. And these metabolites had not been really tested for their biological activity. Next slide, please. And so we undertook validating this plan further by isolating compounds, determining their structure, and checking their activity towards cancer, bacteria, and cardiovascular diseases, and to exploit ways of using these plants further. Next slide, please. And so we perform extraction on this plant by crushing and extracting and macerating in a 1:1 mixture of dichloromethane methanol for 48 hours, after which the filtrate was evaporated on rotatory evaporator. And we obtained a fruit extract, partitioned it into different fractions using solvent. The fractions were chromatographed on silica gel, which gave few compounds and sometimes mixtures that were further purified on HPS. Next slide. Now, the pure compounds obtained were submitted to NMR experiments, mass spectroscopy, infrared, optical rotation, ultraviolet analysis, and sometimes specular dichroism to get data necessary for structural determination. Next slide, please. Good. I just want to run us through a quick look through how it feels like determining the structure of certain compounds. So this is the proton NMR of one of the compounds we isolated. And you can see up here towards the right, 6 CH3 methyl groups. These are common to triterpenoids. And to the left side of the spectra, around 5.6, we can see a proton, which is characteristic of a tri-substituted proton on triterpene molecule. Towards the middle of this spectrum, we find a doublet around 4.3, which is characteristic of anomeric proton on sugar, and oxymethylene protons around 3.8, oxymethine protons around 3.2, indicate that this compound contains a sugar and a triterpene. Now, next slide, please. On the carbon NMR, there were 36 signals. We could quickly identify signal at 128 and 139, which is diagnostic of olean type triterpenoids. We also noticed the signal at 182, which is the carbon of an acid, and the anomeric carbon at 106, methylene and methine carbons of the sugar around 100, around 70 to 62 ppm. This now confirms to us that we are dealing with a triterpenoid which could be attached to a sugar. Next slide, please. Now, the depth 135 help us to identify 6 methyl groups as shown by the proton, 12 methylene, 10 methine, and consequently 8 quaternary carbons. Next slide, please. With the COSY help us to determine 3 bond correlations between protons. Next slide, please. And the HSQC permitted us to link particular protons to particular carbon atoms. Next slide, please. And the HMBC permitted us to link a proton to carbon 2 and 3 bonds away from it. And next slide, please. This permitted us to develop the structure which is shown here. Now, this structure shows us the linkage between the sugar and carbon number 3 of the triterpenoid, which was identified clearly on the HS2, showing us that the compound is actually a triterpenoid saponin. Now, comparing the mass calculated for this structure and that reported from the experiment, they agree, permitting us to get this structure correct. Next slide, please. But one thing was lacking, which is determining what phase of that structure carries the sugar molecule. So we turn to the noisy spectrum and notice that the carbon anomeric proton of the sugar is correlated to carbon number 23, which is emitter of the triterpenoid, and that same carbon proton number 23 is linked to proton number 3 on this spectrum, permitting, next slide please, permitting us to indicate that the sugar is attached to a beta orientation. Taking the literature, the chemical literature, we notice this molecule has never been reported. And in line with previous reports from this plant, we gave it the trivial name tetrapteroxide C. Next slide, please. Using the same approach, we're able to identify 23 compounds out of 30 isolated. So they belong to different classes, as you can see. Next slide, please. We obtained 5 new molecules previously not reported and named them tetrapteroxide C to F, and molecule number 5, which we didn't indicate its name here. Next slide, please. And so these are further compounds isolated from the N-butanol fraction of this plant. Next slide, please. Flavonoids also were isolated from particularly N-butanol fraction. Next slide, please. Steroids and some sugars were also isolated. And so, next slide, please. We submitted this compound to anti-cancer, the extract and compound to anti-cancer assays, and we found that the extract had significant activity against 9 cancer cell lines with activity IC50 values between 18 and 36 micromolar. And compound 16 was also significant between 10 and 31 micromolar. And we compared their activity to that of doxorubicin, a standard drug. Next slide, please. Now, the most interesting molecule from this plant is called aridanine. It was isolated before for the first time around 1985. And we isolated and submitted it to anti-cancer assays. Next slide, please. And we found that this compound showed activity against 18 cancer cell lines, and the toxicity was not that much. Next slide, please. So these are further anti-cancer assays that were performed on aridanine. Next slide, please. We also submitted molecules, especially flavonoids, to antibacterial assays. Next slide, please. Now, we did so on 10 cancer cell lines, 10 bacterial cell lines, 8 of them being gram-negative and 2 gram-positive. This test turned out to be 100% effective, particularly on Staphylococcus aureus. You can see the results highlighted in red with activity between 4 and 128 micrograms per milliliter. Next slide, please. So these are further antibacterial tests on other strands. And so this is the antibacterial assay. The next slide, please. Now, we also found from the literature that this plant was used against diabetes. There's a lot of reports. And we know that diabetes is linked to cardiovascular mortality. Therefore, we studied this plant by some compounds from this plant in silico to find out their anti-diabetic activity. Next slide, please. So we dock these molecules, these flavonoids, together with the standard drug miglytol against alpha-glucosidase. Next slide, please. Now, this is compound 10 interaction with alpha-glucosidase. Next slide, please. And in this slide, you see miglytol and alpha-glucosidase interaction. Next slide, please. Now, the five compounds studied in silico showed better more DOC scores and binding affinities than miglytol. And looking at the interactions, we noticed that miglytol forms conventional hydrogen bonds only, while the isolated compounds form conventional hydrogen bonds together with pi-pi-alkyl and pi-alkyl hydrophobic bonds, making them maybe have better affinity to alpha-glucosidase, which is an enzyme. Next slide, please. We also perform pharmacokinetic studies in silico on the isolated compound and notice that they obey the King's 5 rule. The compounds were not toxic and they had good oral bioavailability. Next slide. Now, structural activity relationship studies on the isolated compounds, the flavonoids particularly, shows that generally flavonoids will be more active or inhibitory towards alpha-glucosidase if they have two OH groups on them. Now, when they are substituted by methyl groups of sugar molecules, it tends to reduce their activity. And so all the compounds studied for alpha-glucosidase were active because they had three OH groups. Next slide. Yeah, as shown on this slide, we see that they all have three OH groups, and so they surely should have a good alpha-glucosidase property. Next slide, please. Now, we noticed that the diseases mentioned in this work, that is cardiovascular disease, cancer, and bacteria, always sometimes are linked to the word lifestyle. And so studying plants and molecules from plants to make drugs is a sustainable way of treating this infection. Next slide, please. So to wrap it all up, what we have been able to show you is that tetraptera is rich in molecules that can address microbial drug resistance, cancer, and cardiovascular disease. Now, this plant is very abundant in West, Central, and even East Africa, and so it can provide a sustainable feedstock for drugs that could be applied in clinical treatment. And given that this plant is a spice that has been used over centuries, and some toxicity studies we carried on it confirm that it's not toxic within 7 doses. Now, in this work, we isolated triterpenoids and proved that the reason why the plant could have anti-cancer properties. And we showed that flavonoids present in this plant are linked to antibacterial as well as cardiovascular disease. Now, even though our study on anti-diabetic property was just in silico, we hope to extend that to bench work that is in vitro, in vivo, and even clinical studies. Next slide, please. So we hope to submit tetraperoxide C2F for anti-cancer studies. We have not done that yet. And also determine the mechanism of action of the molecules isolated, and collaborate with people like the first presenter to do clinical studies and extracts from this plant. And we intend to further our studies to the other species, Tetrapleura, which has not been studied. Next slide, please. You can read more about our work on this publication. We have published in Natural Product Research Journal. Next slide, please. Phytomedicine. This is the single molecule arginine and anti-cancer. Next slide, please. And toxicity studies have been published on this journal. I'll end up by, next slide, please, recognizing people who have helped me to rise to where I am in research. Professor Ibrahim Benitach, presently I am working in his research team, and so I'm grateful for that. Professor Victor Casey, who carried out most of the bioassays. Professor Buea, who initiated this work. We know I ran from the work at first sight, and Professor Ngaji, who came to in the field of natural product research, natural product chemistry. Now, this work was funded by WAS and ICCDS, provided logistics. Before NAPSA started, when I worked with Professor Buea, and at the University of Botswana, I got logistics for the work. Thank you for listening to my presentation. Thank you. Next slide.
Thank you very much for this very interesting and very comprehensive presentation. Let me stop the sharing, please, and open the floor for, I think we have many questions for you. Thank you very much, Dr. Chi. So if there is any question from the floor, please go ahead. Just unmute yourself and ask your question.
Thank you very much for this. I'm Professor Mtale Wilbrod from Zambia, the University of Zambia. I'm a researcher in public health and also clinical medicine. So I'm interested in the anti-diabetes, and I think you didn't mention, you said diabetes, but you didn't mention hypertension. So two things. Did you also evaluate any response on hypertension? And then the second thing on the diabetes. So what is your message there, and what will be our next step to refine this to the next level? Thank you very much.
Okay, thank you for your question. I underline anti-diabetic and hypertensive. So like I showed in my presentation, it was just an in silico study, and we are still doing the bench work to carry out in vivo studies on diabetes and rats. Anti-hypertensive, we are still thinking on that. For the moment, we have done nothing. I hope that answers you.
Thank you very much. Thank you. Thank you so much.
Professor, I was just asking.
Good afternoon, all.
Possible to have those slides to share with us. Thank you.
Yeah, sure. We will share all of the slides. Dr. Chi, can we share the slide on the NAPRECA group, please?
Of course, sir.
Thank you very much. Okay, we'll share it on the NAPRECA group.
Thank you. Dr. Nyirenda from the University of Zambia again. Thank you, Professor Mtale, for the question. Would like to also look into the glucosidase, alpha glucosidase activity assays. I think one of our students is here, Mr. Lamek Tembo. You would probably like to learn more how we can set up the alpha glucosidase inhibitory tests. Do you have anything you can discuss that scope?
All right, I think we can discuss that backstage. You can get we can contact ourselves through the NAPRECA group, and we expand on that.
Yes, I was also asking, you were able to isolate 5 compounds from this plant. Tell us about the yield. How was it?
All right, we isolated over 30 compounds, not 5. And we were able to determine the structure of 23. So the yield, in some cases, for example, the triterpenoid saponin, which I presented, the yield was quite low and difficult to to get. We finally got most of them through HPLC because they were so close and difficult to separate from each other. Now, the most abundant compound in this plant is the one I presented as aridanine, having good anti-cancer properties. In fact, from 1 kilogram, I got more than 10 grams. Did you hear that?
Yes, sir. Thank you, sir.
And a question from my side, Dr. Chi, please, why you didn't do the alpha glucosidase activity in vitro? I mean, I think this assay needs very small amounts. Why did you do the docking on the alpha glucosidase and you didn't do it in vitro?
All right, that's a good question. Actually, we are doing that at the moment. So we started by trying it on in silico to see if it is actually good, even though structural activity relationship told us that. We wanted to do in silico and determine whether we can continue. So we are presently doing that. I have separated more of the compound and we are doing that.
Okay, it will be very nice to compare the docking results with the in vitro results, I think.
Absolutely.
Yes, yes, good luck. Yeah, very nice work, actually.
Thank you.
Any other, please, let's have a stimulated discussion. Still, we have 5 minutes left. So if there is any other question, please go ahead from the floor.
Yes,
Go
Dr.
ahead,
Same.
please. Yeah, Professor Mabala, please.
Yes, thank you for the floor. I would like to thank the presenter. It's a good work indeed, but I have some few concerns. The first one is about the solvent used. One is he was talking about the crude extract. What was the solvent for that
Yeah.
extract? Secondly, all the compounds. Did all the compound come out from one extract or use several extracts? These are the two questions for the moment that I would like to get some answers.
All right, thank you for your questions, Professor. The solvent we used for extraction, dichloromethane methanol 1,1 mixture. And when we obtained the crude extract, we partitioned it into different fractions using hexane ether acetate and butanol. And we performed purification on these different extracts. But the most yielding extract was that from N-butanol. I hope I've
Okay. Yes, that's okay. And about I've seen that you have isolated one of I think one of your compound. One was a glycosamine. Did you find any particular activity, biological activity for that compound? I think it was number 7.
Oh, thank you for that. That is the most active compound from this plant. Like I said, it showed good activity against 18 different cancer cell lines, good to moderate. And so it was the most active compound and the most abundant in quantity.
Okay, the last question, the last concern is about the two types of compound you have isolated. I've seen that you have isolated triterpenoids and flavonoid. Do they come all from the same solvent extract?
Yes, most of them came from N-butanol fraction. And so reason being that flavonoids are soluble in the polar solvent as well as in water, and triterpenoid saponins, most of the compounds were saponins, so they tend to be soluble in very polar solvents. So most of the compounds came from the N-butanol side.
By any chance, did you have a look on the water extra? You haven't done it?
Yes, I haven't done that. We are thinking on that. I didn't have material appropriate for that, but in our future studies, we consider that.
Okay, thank you so much.
Thank you, sir.
Any other question? So if there is no
And
question, yes, please go ahead.
if there's no question, I can just ask one.
Yeah, please go ahead, please. Professor Mabala, please.
About the sugar.
Yes.
About the sugar which was connected to the triterpenoids. Most of the time we know that it should be a glucose. How sure are you on that issue? Are you sure that it's really a glucose, not another epimas, something like that?
All right. Thank you for that question. We did a lot of comparison, and we also proceeded by doing what you call hydrolysis of the sugar molecule and comparing on HPLC as well as mass to be sure that we have glucose. So they are glucose molecules.
Okay.
So thank you very much to Dr. Chi for this very comprehensive and informative presentation. I really personally thank you very much for your efforts and willing to do the presentation today. I also thank the first presenter, Professor Fono Nang, for his presentation in the first presentation. And I would like to end up this meeting saying happy holidays for all of you, and hoping for the coming new year to be a prosperous and successful year for all of us. Thank you very much.
Thank you so much, sir.
Thank you.
Thank you.
Thank you.
Thank you very much.